Across the country, schools reversing their decision to hold in-person classes after COVID-19 outbreaks. At UNC Chapel Hill, classes abruptly halted just days after move-in. Students there not tested before coming back. But at Purdue University in Indiana, an unprecedented undertaking. Before all 40,000 students start classes this month, they're required to take a COVID test.
Testing will be very, very important and will be a key element of protecting our college campuses.
But unlike most COVID testing that involves a large, often uncomfortable swab, to get a sample from the back of the nose, Purdue students will just spit into this tiny tube, something they can do at home with this kit.
The convenience of that, and so I think particularly for this generation of students, was a good one that allowed us to reach them where they were.
Purdue is one of 65 schools working with Vault Health, formerly a men's health company, now offering this at-home COVID saliva test developed by Rutgers University. Is the saliva test a game changer?
It is a game changer. First of all, it's a much easier test to administer. You're spitting into a tube, which just about everybody can do, even kids, and you're just giving us enough spit to be able to tell if there's a virus in there.
I ordered a kit from Vault's website. It arrived in 2 days. I have my materials here. What do? I set up a video chat with a clinician who made sure I did the test correctly. I made sure to not eat, drink, or put anything in my mouth for 30 minutes.
All you need to do now is go ahead and spit.
Oh man, this is gonna take a while.
I think the record was about 30 seconds.
I was not so speedy. How many times a day do you have to watch people do this?
Enough.
2 minutes later. Any tricks to this?
Yeah, smelling pickles in a jar, thinking about food, smelling citrus.
You should have told me to bring my pickles in a jar out sooner. I have nothing. All right, let me think about mouth-watering foods. I feel like it's working. It took some time to work up about a spoonful of saliva. Am I there?
Oh, that's pretty good.
Yes.
You're there.
A quick mix with a preservative to keep my sample fresh. Then I put it in a pre-addressed bag to be overnighted to the Rutgers lab in New Jersey. Vault says results are available in 2 to 3 days, a big advantage over swab tests that have seen delays up to 14 days. Vault's test is one of 2 strictly saliva tests given emergency authorization by the FDA. Yale University created the other one, but it's not an at-home test. How is this test better than what we've been seeing with the nasal swab?
Well, the false negative rate is really what we're concerned with. Telling somebody that they're negative when actually they are sick is very dangerous. And so the saliva test has a 1% or even less than 1% false negative rate.
But scientists caution there's not enough data yet to know how much virus is in saliva.
They're generally very accurate. They're probably a little bit less sensitive than the nasal swab, which is the term we use to mean that if people have very, very small amounts of virus, it's possible that the nasal swab would detect that, whereas the saliva wouldn't.
The test is also pricey, $150 if you order it directly from the company. Right now, Vault is running about 80,000 tests a day, and they say as that number goes up, the cost will come down. For students like 18-year-old Clara Terry, who will be a freshman at Purdue, spitting in the tube was easy.
I've heard with the nose one, it hurts. This was not painful at all.
Now, even though this test is done at home, a key part of Vault's test is you have to do it live over a video call with a clinician to ensure that you're doing it correctly and that it's your saliva. I got the results of my test 2 days later, negative. The PGA, NBA, as you said, NHL are all among the pro sports leagues that are now using these saliva tests. And in large part, they're a lot easier and less invasive than that swab test.
I was going to say, no wonder the kids want them, but there's always a question of cost. So how much would this cost?
Yeah, it's $150, but it is open to anyone. So you just have to go on Vault's website and do that.
So that means you don't have to be a professional athlete. You don't have to be a student. You can just clickety-clack and get the test?
Yes, exactly. But the colleges and universities are investing millions of dollars. I mean, you're looking at 40,000 students at Purdue alone. They say it's a worthwhile investment to try to protect their students and staff.
Okay, and is there a certain time frame, like students need to get this test by a certain time?
For the Purdue students, they want them to take it within 2 weeks before going on to campus. But as you know, Hoda, I mean, you could take the test, be negative, and then a few days later be positive. So there are limitations.
Okay, all right. This is a good breakthrough.